Good morning or good afternoon. I am sorry I cannot be with you today, but we really wanted to be associated with the effort of COFEPRIS in innovation. So I'm pleased to give that presentation about what the European Medicines Agency is doing in the area of innovation and regulatory science. My presentation will have two parts. The first one about our regulatory science strategy with the eyes on the stars, and the second part will be about what we do as of today with the 2 feet on the ground. So innovation is coming to us fast. It's coming as a disruptive event, meaning that we see tools and technologies that we haven't seen before coming to regulators of medicines and are taking us maybe by surprise or at risk of taking us by unprepared. You can see on the left a game which is used now to treat attention deficit and with hyperactivity in children. On the right-hand side, you can see products that have been approved recently, the CAR T-cell destroying cancer cells. So you see that we see different tools and different technologies coming to us for different purposes. So we know that innovation is coming fast. It's coming extremely fast, and regulators cannot afford not to be prepared. At the same time, they are bringing changes, and we need also to adapt and to anticipate the changes that are required from us. And this product, this high technology, need to be made available to patients because they can bring significant benefit and cure potentially. In this context in particular, the International Coalition of Medicines Regulatory Authorities has been working specifically on innovation, and I will present some of these aspects. First, innovation, and you can see here the activities we plan over the years is planned in a certain way. And then suddenly we see new elements coming to us and modifying our investment in resources and time. And then finally, we have another innovation which will again make us reconsider our priorities. So we had to work on the regulatory science strategy. So why now, as you may know, we are in a difficult situation because of the decision of the UK to leave the EU, but we still consider this is a top priority for us. We need to be aware of the trends. We need to be prepared. We need to engage our resources in responding to the needs of regulators, but mostly of patients. And we all do this in the context of our collaboration within the European network, regulatory network, and the strategy that has been defined between 2020 and 2025. So our vision is really to not just protect and safeguard the patient, but also enable innovation to reach the patient, because there is a benefit, of course, while keeping our role to protect the patient. So our regulatory science strategy has a number of strategic goals. And here you can see the 5 goals. The first one is to catalyze the integration, so meaning that we have to incorporate in our daily practice what innovation is bringing to us. The second one is extremely important. We consider that the evidence that will be needed to assess the benefit-risk of technologies needs to be streamlined from the outset. It needs to be prepared so we get the right data, so we can get the right assessment, and that will, at the end, speed up access to patients. This means also scientific quality of the data generated. We work as a patient-centered system with the patient present in most of our procedures and advising us on what is meaningful to them. We also recognize that very often there is disruptive health threat, not just innovation, disruptive health threat. We've seen it recently with Zika, with Ebola. We need to be prepared, we need to be reactive, and we need these new technologies also to respond to the needs of these patients. And finally, we need to work with a research institution, academia, to make sure that we can leverage research outcomes. So we had recently a workshop where we presented the first regulatory science strategy. It's now up for consultation. And the first comment I highlighted on these two slides. First, very important comment, science must lead legislation, not the reverse, meaning it's for us regulators to adapt and not for the science to adapt to existing legislation. It is time to potentially challenge what we have as a regulatory framework. There was a lot of support for EMA as the catalyzer of regulatory science, and also recognizing its existing support to patient-centered innovation. We have at the European level, maybe more specific to European, already partnership with public-private partnerships such as the Innovative Medicines Initiative, IMI, and where we engage with industry and academia to develop tools and outcomes for innovation. And finally, we can see that some areas are particularly critical for innovation, in particular in the case of diagnostic, companion diagnostic in particular, distributed manufacturing, which is challenging very much our regulatory framework, the use of wearable devices, again, more in were used as tools and toys, and now coming to the regulatory system, and of course, as we all know, precision medicine. As opposed to a medicine for a group of patients, each medicine is tailored to the need of an individual patient. The second set of conclusion was that we need to be able to transfer our knowledge. We have different procedures, different steps in the life cycle of product, and we need to be able to move that information forward. We also need to provide training to experts inside the agency, but also experts outside the agency. If we consider, for example, artificial intelligence, we need to liaise with mathematicians. They may not have an understanding of regulatory science. So we need to be responsive to the needs of these experts. And finally, we also want to work in a transparent manner because data sharing is an additional value and an additional benefit which support innovations. So what are we currently doing in the meantime? We are preparing our work. We are already engaging in a number of activities as our main role is to enable innovation, enable technology to reach the patients. We have at ICMRA level engaged in one project on innovation with 3 complementary workstreams. I'm not going to detail the composition, but just to highlight the fact that the workstream 1 was looking at best practice for horizon scanning. The workstream 2, which we co-led with Ireland, was leveraging the outcome, defining the expertise and the regulatory science tools. And the workstream 3 was looking at facilitated pathways to facilitate innovation reaching the patients. So in the case of workstream 2, on which we have been working the most here at EMA, we have identified 3 case studies. We have looked at the outcome of these case studies to try to see what was challenging, what was new, where were the gaps, and what is the need for expertise. And finally, we have looking at capacity building and sharing the outcome of horizon scanning. So this workstream came in complement to the best practice on horizon scanning. And we took the 3 cases of additive manufacturing, in particular 3D printing, because we know that we are now printing medicines, printing devices, printing potentially organs for transplantation, and this is a challenging our current regulatory framework. We have also looked at genome editing because CRISPR-Cas9 had made things easier, cheaper, and we also know that it's used in other areas such as plant and animals, and the human aspect are now in clinical trials. It's challenging us because it affects it's irreversible changes to the human beings, and it can be curative at the same time, so potential extreme benefit at the same time concern about the effect of these modifications. And the third one was artificial intelligence because of the capacity to self-learn from computers. And the aspect of being able to manage huge amount of data, such as, for example, the real-world evidence. So we identified three types of areas. The first one was, what type of regulatory tools do we need? What are the gaps? We need robust evaluation, for example, of devices, of target effect with genome editing. So we want to enable innovation, but at the same time protect patients. We also need infrastructure. We need super powerful computers. We need labs. And we need certainly collaboration with academia. The last point is not the least important, is expertise. As I said, we need to be able to identify the expert. They may not be in the area where we commonly have contact with academia because, for example, artificial intelligence will take us into the domain of mathematics, which was not so common for us. And of course, to engage with this expert, we need soft skills. So ICMRA really aims to foster an ecosystem that accommodates innovation, which is really a new role for regulators. And I'm sure that at COFEPRIS there is the same concern and willingness to engage in this area. So finally, to do this, we are not doing it alone. We engage, of course, with our own network within the member states of the EU. We have an innovation network, and we have a number of stakeholders that need to work with us in this domain, and that is why we've represented that as a beehive. Finally, the first step was horizon scanning, as I said. The second step will be evidence generation to make sure that once we have identified the technology, we know exactly the type of data we want. And for this, we recommend that early consultation of regulators is quite important. We also know that we will not get all the data initially, so we will have to request data post-licensing. Finally, we also need to consider the next aspect, which is the added therapeutic value, relative effectiveness, pricing and reimbursement, because this is really the step that is necessary in order for the technology to reach the patient. And finally, our system is really a good example of mutual reliance and working together. So we are preparing the whole network to deal with innovation. Just to take you to a specific example on how we see what we do today, we are already working on some of this aspect to improve the benefit-risk evaluation and the scientific quality of our evaluation. For example, we have worked on modeling and simulation. We also have a preferential treatment of a product of high interest which are meeting unmet needs called PRIME. We are working on the communication on benefit risk, and of course we are working now on real-world evidence and bringing it to support the decision on benefit risk. So we will have to support innovation with specific aspects, and these are actually already ongoing. Innovation in clinical trial design that we see when we discuss at scientific advice before approval, the use of different types of data through real-world evidence, using registries. We have big initiatives on registries in Europe because we believe this is going to provide structured data that can be used. And finally, adapting this data to the individual patient. As I said, for us it's very important, but for any other country it's the same. The real thing that will make a difference is whether the patient will have access and can afford the treatment, the innovation, and that they deserve. So back to the future, as we know, difficult situation, but we are very certain that by next year, by the end of next year, we will back to normal, and we will be able to implement our strategy, regulatory science strategy. But really for us, be assured that we will not rest until access of innovation to patient is ensured. Thank you very much.